to that. And obviously the next paper brings us back to March 11th, 2011. Dr. Shimokawa is going to discuss the Great East Japan earthquake disaster and cardiovascular disease.
So good morning, ladies and gentlemen. It's my great pleasure to present our study on the Great East Japan earthquake disaster and cardiovascular diseases during today's Hotline topic session 3. I have no conflict of interest to disclose regarding this presentation. As you all know, last year on March 11th, the Great East Japan earthquake attacked the East Japan, including our Miyagi prefecture here. And during this disaster, approximately 16,000 people dead, and approximately 3,000 people are still missing. So our Miyagi prefecture, here shown in green color, became the center of the disaster because of its geological relationship. And in this Miyagi prefecture, approximately 60% of the casualties happened. So actually, the real center of the disaster. So in this disaster, we aim to clarify the impact of the earthquake on the occurrence of cardiovascular diseases. So for that purpose, we decided to examine the ambulance transport record in the Miyagi prefecture. When looking back the previous studies regarding the cardiovascular diseases and earthquake disasters, such as Northridge in the United States and Hanshin-Awaji in Japan, Indian Ocean in Indonesia, and Mid-Niigata in Japan, and Wenchun in China, researchers examined the occurrences of particular cardiovascular diseases in a limited area for a limited follow-up period. And they reported the significant increases in, for instance, sudden death or myocardial infarction. When we decided to examine the occurrence of cardiovascular diseases, we noted that at that time, no information was available on the occurrence of cardiovascular diseases for a large population and for a longer follow-up period and for all major cardiovascular diseases. So we pay attention to all these 3 points. So we designed the present study, and we determined the ambulance transport record obtained from all 12 fire departments in the Miyagi prefecture with 2.3 million population community. And the study period was set for 15 weeks from February 11th to June 30th. So it's 4 weeks before and 11 weeks after the earthquake in the previous 4 years, including, of course, the year of 2011. So the number of medical records collected was 120,000. And we examined the occurrences of the diseases, including heart failure, major 5 diseases, including heart failure, ACS, stroke, and cardiopulmonary arrest, and pneumonia. So in this study design, we'd address the occurrences of 5 major cardiovascular diseases and pneumonia in large population for a longer period as compared to previous studies. So this slide shows the main result of our finding. This slide shows the weekly occurrences of the 5 diseases we examined. As you can see, the weekly occurrence of heart failure and ACS, stroke, and CPA, all causes or cardiopulmonary causes, and pneumonia were all significantly increased after the Great East Japan earthquake, as shown by black arrow. But we found that there are 3 different time courses for the occurrences of cardiovascular disease and pneumonia. The occurrences of heart failure and pneumonia significantly increased just after the Great Earthquake, and then only gradually return to the previous level. And especially for pneumonia, it took 3 months, almost 3 months, to return to the previous level. And the second pattern was found for stroke and CPA. The weekly occurrence of stroke and CPA rapidly increased and rapidly decreased. And very interestingly, it increased again in response to the largest aftershock, which occurred on April 11th. This is actually the second peak. And the third one was found for ACS. ACS occurrence, again, significantly increased after the Great Earthquake, and again, rapidly decreased. And very interestingly, in the third month, the occurrence of ACS was rather significantly decreased as compared to the previous 3 years, which suggests that accelerated occurrence of plaque rupture or plaque erosion in those patients. And these results also suggest that there may be some difference between ACS, acute myocardial infarction, and stroke, although they are both atherothrombotic diseases, but could be some differences exist in terms of the response to acute stress. And we also analyzed the subtype of stroke, and we found that cerebral infarction incidence was significantly increased, whereas the incidence of cerebral hemorrhage, intracranial hemorrhage, remained unchanged. That was in contrast to our expectation. We expected that because blood pressure was increased in almost all residents, so we expected the increase in intracranial hemorrhage. But the fact was just the opposite way. We found that the occurrence of cerebral infarction was increased rather than intracranial hemorrhage. So this is the main message. Thank you very much for your attention.